can happen is when our C3, C2 vertebra are out of place, so in your neck, you can have referred pain into your sinuses. Okay, so your frontal, your maxillary sinuses. So it is nice to, when you're doing some work with clients with neck problems, to make sure that you do some release work through the sinuses, some trigger points. So I like to do this. Josh, can you grab the middle? Yeah. Oh, there's one I prepared earlier. Okay. And he was very excited when he heard that we're doing this. So what we like to do is we take the dome and you're going to put that right in the middle of your forehead, just on your third eye. I like to make sure when I do that, I have my hands holding like that, okay? And so what he's going to do is just massage around that point there. Very nice. Just around the pituitary, yeah. And what we're going to do is we're working 9 spots along the face, and we'll just do one side with you now. Now, once you've done that first spot, you're going to go over to just to the arch of your eyebrow. And you're going to just, again, move the dome in and just roll that around, just around the top of that eyebrow. You okay? He seems to be okay. And then you go into the temple. So we do all on one side, okay? Into the temple, about 10 to 20 seconds in each spot. You okay? Then we go into the middle of your cheekbone. And you'll work through there. And then the next one will be into the side of the nose. So in other words, we're working right around the orbit, which is the fancy word for the eye, okay? But it's an area that can get very congested. Is that all right, Josh? I keep asking because it can be too much for some people. So we've done 1, 2, 3, 4, 5. Then what you do is you go to the edge of your jaw. So just underneath your ear. The technical spot is around the mastoid process. So that's spot 6. Massage along there. Then you go halfway between your edge of your jaw here and your chin. And it's a point called the angle of your mandible. And you go in there. Ooh, icky. And then you go to your chin and you go in through there. And then as your special treat, after you've done that, you go underneath your jaw, up and in. Press in. Just enjoy that. And what you would do is do those 9 spots, and you would do 3 to 4 times on that side, and then do 3 to 4 on the other side. It's really nice to just do a check of your breath between the two as well. How's that, Josh? Happiness? Mm-hmm. Okay. So, feel better? Mm-hmm. Now, once you've done that, it's also nice to then do a little series of work around your skull to help release through the skull, because that can get very tight as well. So when I'm talking about sinus problems, we're seeing a lot of problems also through the frontalis muscles here and through the skull, okay? Josh can attest to this. So we're going to do another part of it. You're going to grab your dome and you're going to put it right on the very top of your fontanelle, yeah? And just go in and just massage around there. Enjoying that? Mm-hmm. This can be a very tight little spot for people as well, so let them work at their own pain level. And what we're going to do is from there, you're then going across just to the middle part. Yeah, good. It's like you're having a nice little head massage, I know. It's better if somebody else is doing that for you. I realise that. But sometimes you just have to do things yourself. How's that? Mm. And then you go along to the middle. And then, Josh, what we're going to do is what's called a little sphenoid release. So just so that you understand, the sphenoid bone is a bone in the middle of your skull, and it forms part of where your eyes sit, okay? And at the top of the sphenoid bone is where your pituitary gland sits. And underneath that is an area called the sulcus turcus. Fancy words again. But basically, that is like a little dome that sits, and it should sit in alignment with all the other domes or diaphragms of our body, thinking your palate, your vocal cords, your diaphragm, pelvic floor, blah-de-blah. So sometimes our sphenoid can be a little bit tight and locked, and that can also contribute to some of these sinus problems. So Josh, what you're going to do is put one of these in each hand. And you're going to find your cheekbones and the edge. Now you're going to just press in, and what you're going to do is press in and up and then dial that forward just one way. Just dial it forward, smile for the camera, make sure that this looks really happy and enjoyable, and then release. The first time I did this, it was like I could film all my face just releasing. It was just so fantastic in a good way. It wasn't like it was dropping from gravity, but it was like I felt the tension go out. So Josh, you have, is that better? Okay. So what we're going to do next for Josh is he's going to just do a little bit more work on releasing through the fascial muscles that can be the facial muscles, I should say, and the fascial line along your cheekbone. This area can get very tight, especially if you're a jaw grinder. So what you're going to do is take that, and we're going to insert at the beginning, and you're just going to do one side and just roll and dial it up. Okay? Then you take it further along your cheekbone and do the same thing. Roll and dial it up. And then along, is that all right?
Yeah.
And you get this, it's almost like you feel like someone's just ripping your face, but at the same time, when you finish doing it, you go, oh, how lovely. And this is a series that I really like to do with some of my clients who have things like scleroderma, which is an autoimmune disease which my father died from. And unfortunately, it results in a tightening of all the skin. And it's not going to stop the disease, but it helps break it down and just trigger through and just try and keep flexibility in the face for as long as possible. Because as the facial muscles tighten, you start to see this contraction of the face, and they can end up losing their teeth, and it's just very unpleasant. So keeping this sort of work happening is really nice. You can do the same sort of stuff by then taking this underneath your jaw and just working up and along the jaw. And you can dial it as well at the same time. I like the little waves on this because it's sort of, it's just a little bit more gentle, but at the same time grabs it. Again, for people who have a lot of these problems in their face, they can also end up loading up their vocal cords, and they can get a lot of tension through here, okay? So what I like to do is take the dome, and I just like to put it just on the edge here, and you're just going to slide it up. Now, some people will use their thumb and their fingers for this, but remember, for some people with things like scleroderma, they'll also start to lose use of their hands a lot and the dexterity in their fingers. So what's kind of nice is by using this, you can use more the wider part of your hand to help press it in and control the pressure. How does that feel, Josh? Yeah, smile. So the next part of what I just want to finish doing is just around the platysma muscles. So that's a muscle that sort of sits around the collarbone here for the front of your face and attaches in at the jaw. So it's nice to get a good stretch for this. So what I'm going to do, Josh, is I want you to put the dome just at your sternoclavicular notch, so just on the sternum, okay? And what he's going to do is pull that down a little bit as you bring your chin to your chest. Yeah, good. And don't press in to sort of slide it down a bit. Now, open your mouth. Keep your mouth open and keep sliding it down as you take your head back. Yeah, good. And at the end, close your mouth. Good. Is that all right? It's kind of intense stretch, I realise. But again, it's keeping those superficial muscles stretched allows you to unlock or unload your vocal cords.